Katherine, thank you. 7:33 right now. A major breakthrough in the fight against Alzheimer's disease.
Yeah, for the first time, doctors will be able to administer a blood test instead of a series of diagnostic tests and neurological exams to help maybe detect the disease that affects more than 6 million Americans. Here to tell us more about this test is Dr. Katherine Amodeo, a neurologist at Westchester Medical Center. Doctor, thanks for coming in.
Thank you for having me.
Oh, it's our pleasure.
Yeah.
We know that Alzheimer's is a buildup of a protein in the brain. Now, how could this blood test potentially detect who might ultimately get that?
Yeah, so exactly what you just said. So what we know with these neurodegenerative diseases like Alzheimer's, there's an accumulation of these abnormally folded proteins, phosphorylated tau or amyloid beta. This blood test is the first blood test to be able to detect one of these abnormally folded proteins, even in the early stages, specifically phosphorylated tau.
Yeah, so how many tests, though, and screenings does it actually take to detect Alzheimer's?
Yeah, so at this time, the diagnosis honestly is largely clinical. You know, when somebody shows symptoms, we do an exam, we do neurocognitive testing, and then we have supportive biomarkers at this time, which are largely costly and inaccessible. PET scans, lumbar punctures with CSF analysis. So to have a blood test is critical.
So it would be just one test?
This blood test would allow for accurate diagnosis of Alzheimer's.
And just one?
Yeah.
That's amazing.
Yeah, so people would be able to qualify actually for clinical trials for Alzheimer's as well as the, disease-modifying therapies, where at this time they have to get a lot of imaging and so forth. So to have a blood test, it could perhaps replace those.
That would be remarkable.
Yeah.
When could it be available widely anyway? Would it be expensive as well once it comes online?
That's a really good question. So at this time, the test is largely just for research use, but it is, coming to the U.S. for clinical practice very soon. We don't know when, but they estimate within the month. As far as cost, I think that's to be determined. I think checking in with your insurance providers and so forth will be important.
What does it actually affect in men, Alzheimer's?
So, it's interesting. Honestly, everybody's at risk.
Okay.
It's a disease of aging, so perhaps, women do tend to live longer, although we're seeing those statistics even change, but
yeah,
it's a disease of aging.
Because I think a lot of people are wondering, like, preventative measures.
Yeah, so that's what I think is also so important about this, is that, given that it can detect even preclinical, meaning before the onset of symptoms, it just calls attention to the importance of incorporating those strategies for prevention. And that's important for all of us.
Yeah.
Eating well, the most evidence we have is for the Mediterranean diet. So I always tell my patients, if you need to learn, maybe take a trip, but the Mediterranean diet, socialization is critical.
Okay.
So keep those social networks and exercise. I can't say enough about the importance of exercise.
Sometimes we hear about crossword puzzles. I've heard ping pong, learn how to play an instrument. Are these kinds of things, Sudoku, are these going to help protect you a little bit?
So what we know is it is important to, continue to do those cognitive strategies. And so I say, if you like it, do it, because it may be helpful.
Yeah. Does race actually have an impact? Also, I mean, like, if you're Black or Hispanic, are they more susceptible to it as well?
Again, Alzheimer's doesn't discriminate. It is present in every culture, every race.
No.
I guess the reality is, is our detection technology getting a little ahead of what we can? You might say, John, you're going to get this. Can we really stop me from getting it at this stage of the game?
So we are incredibly hopeful. It's an exciting time, as you know, with the FDA approval of the monoclonal antibodies against one of the other hallmarks, amyloid beta. I think this is an exciting time, we're hopeful. And with this actual blood biomarker, it can catapult trials because we have a way to objectively measure the benefit of the treatments. So,
in the meantime, though, if you don't qualify for this blood test, what can you do? Like, is there anything that they should look out for that may make you think I could be? I
think that's a wonderful question that certainly we encourage now. If there's any concerns, family history. Okay. But if you're noticing so the key is that if the change persistent. So I'm more forgetful. It's not just here and there. It's persistent. It's in my everyday. I'm really having trouble with retrieval, pulling up that word. Those are things that we would say, speak to your primary care provider, but also, you know, then get the referral to see a neurologist like myself.
All right, Dr.
Yeah.
Amodeo, thank you
Thank
so
you.
much for coming in.
Thank
Good
you for
This is
having
really
me.
groundbreaking.
Yeah, it really
Yeah,
is.
yeah, we're very
Huge news.
excited.
Appreciate
Thank
it,
you for
Doctor.
having